friends of Nordics, ladies and gentlemen. My name is Sami Askilainen from Nordic Innovation House, and I'll be your host today. So it is my great pleasure to warmly welcome you all to our Nordic Digital Health Care Ecosystem webinar, and we are very, very honored and delighted to be part of amazing Galen Growth HealthTech Summit in 2020. And then let's have a look at our agenda today, which is fairly straightforward. First, we're going to hear a couple of words about Nordic Innovation House, after which we will have a very, very interesting keynote about Nordic Digital Healthcare Ecosystem delivered by Paul Kastman, who is Director at Nordic Innovation Norway here in Singapore. And then after the keynote, we will jump to the exciting panel during which we will explore more the Nordic digital healthcare landscape with 4 Nordic startups who are sharing their insights and experiences from the Nordics. But let's start with the Nordic Innovation House first. So Nordic Innovation House is essentially a community platform accelerating and supporting high-quality Nordic tech startups, scale-ups, and growth companies that are coming to Singapore. And of course, many of them are using Singapore as a springboard then for the Southeast Asia markets. We are supported by the Nordic Council of Ministers and Nordic Innovation, which is headquartered in Oslo. And I would say that we have quite unique collaboration between the Nordic countries, and part of our Singapore team are Business Sweden, Innovation Norway, Embassy of Finland, and Promote Iceland. And our daily work is, I would say, industry agnostic, but then we're running these specific market entry programs in key verticals such as Med and HealthTech, which one in Smart Cities, which is in October, and then our Sustainability and Impact program will take place in Q1 2021. And if you want to find out more about our activities, either in Silicon Valley, New York, Singapore, or Hong Kong, or Japan, please visit our website, www.nordicinnovationhouse.com. But now it's time to then move forward, and I'm going to hand over the stage to Paul Kastman, who will tell us more about the Nordic digital health ecosystem. Paul, over to you.
Thank you very much, Sami, for that introduction. I think it makes sense to start with the basics when we're going to talk about the Nordic digital health ecosystem. You often hear Northern Europe referred to as Scandinavia or the Nordics. But just to clarify, the Nordic region is comprised of Finland, Sweden, Norway, Iceland, and Denmark. These countries are all well-developed democracies with relatively small economic differences. The core qualities of the region are an important reasons why the healthcare systems are regarded as both of high quality and equitable in an international perspective. Combined, the Nordic countries have complementary strongholds, which create synergies through close collaboration. I'll get back to that a little bit later. Clustering and collaboration lead to innovative and comprehensive solutions and strong concepts targeted towards international stakeholders. Across the globe, advances in the field of healthcare have helped raise life expectancies dramatically, and new treatment methods, advanced diagnostic techniques, and an increased focus on prevention mean that the average global citizen will live much longer than he or she did a century or even a decade ago. While this is a positive development, of course, it also presents healthcare systems across the world with new challenges. And the main one is the increasing strain on healthcare resources, both financial and human, due to aging populations and a rapidly growing number of patients with chronic diseases. The Nordic region, like all developed countries, is trying to find a solution to its increasingly aging population. Now, the baby boomers are now 70 plus and will represent significant pressure on the healthcare system in the very near future, while the working population for each person above 65 is decreasing. The demand related to this aging population is mainly focused on primary care, and there is a high demand on home care solutions supporting elderly and patients suffering from chronic diseases. And for these reasons, there is a high focus on the prevention and early diagnostic of chronic diseases and cancer in the Nordics. There is a high focus on cost and time effectiveness. There is a high focus on local or home care, which is also environmentally friendly, of course. And then there is digital solutions. The aging population issues is a worldwide problem affecting mainly the developed countries as of now, but also the emerging countries. The Asia Pacific region, for instance, represents 4.5 billion people altogether, meaning an estimated 1.4 billion elderly people by 2050. At the core of the Nordic welfare model lies the principle of universalism and broad public participation in various areas of economic and social life, which is intended to promote equality of the highest standards rather than an equality of minimal needs. Furthermore, decision-making is partly decentralized to municipalities, and for the hospital sector, decision-making is decentralized to regional authorities. The Nordic healthcare systems all share the 4 characteristics shown here. These characteristics, combined with the fact that each citizen has a unique identifier, a social security number similar to SingPass in Singapore, motivates and enables digital transformation and new business models within health and care sectors. And the Nordic countries are ahead of the curve in technology adoption and business model initiatives centered around integrated care, personalized medicine, value-based healthcare, population health management, and others. Now, as this figure shows, this integrated and personalized service delivery is at the heart of the Nordic healthcare service provision, and it aims to address the pressure on the demand for health services from the aging population, the growing rate of chronic diseases, and the increasing expectations of patients. And in this way, the healthcare and e-health strategies in all the Nordic countries both support transformation of the Nordic healthcare systems and comply with digital transformation initiatives and a sustainable roadmap for change. The Nordic region has a strong position when it comes to digital transformation due to alignment between healthcare strategies and supporting digital solutions. The ability to clearly formulate needs and requirements and communicate them to vendors has made a huge impact on the way care is delivered, not only as digital innovators in a small-scale projects, but also when it comes to scaling solutions enterprise-wide and often across the care continuum. In the Nordic terminology, to integrate does not only mean to share data, it also is about integrating stakeholders around the patient, as well as health and care organizations and ICT vendors. No other region within Europe is as advanced as the Nordics when it comes to digital transformation, which at the same time has supported commercial growth. Public-private partnerships, innovation labs, and other collaborating project models have been adopted to inspire ICT vendors to become engaged in the Nordic Healthcare Change project, which again has led to world-class digital solutions. So, if we look at some of the strongholds of the Nordic region, there are several areas I could mention. There are, however, a couple I'd like to highlight. When it comes to sustainable and innovative hospitals, this stronghold consists of different industries that participate in the construction and maintenance of hospitals, everything from architects, companies within construction and engineering, solution providers for increased energy efficiency and environmental performance, logistics providers and producers or suppliers of medical equipment. There is smart digital solutions, which encompasses e-health solutions and solutions that facilitate communication in the health sector. And then there is ambient assisted living or care technology, which includes monitoring, self-care solutions, rehabilitation equipment, etc. And finally, personalized care. So products based on collection and or use of big data to create personalized health solutions. We've been working closely with partners in Singapore to foster partnerships between Nordic and Singaporean stakeholders. In May, we organized a webinar with the UNDP and the National Hospital Clusters focusing on COVID-19 solutions. And last month, we had a virtual market visit program for 18 Nordic health tech companies that spanned 2 weeks. We're going to meet some of these companies later in the panel discussion. So without further ado, I'd like to give the floor to them. Thank you very much.
Great. Thank you so much, Paul, for sharing these super interesting insights. And now it's just time to start our panel and get really deeper to the Nordic digital health ecosystem with the 4 exciting companies. So we have ADESANTE, Ninchat, Brighter, and Secapp with us here today. And I also want to highlight that all these companies are participating to Galen Growth HealthTech Summit this year with the virtual booth. So please go and engage and continue the conversation with the companies at the booth. But let's jump to it and let's start then with the introduction. So could you all tell us briefly in 1 minute who you are and what is your digital health solution? And we can start with Petteri.
Thank you, Sami. Like you just introduced, my name is Petteri Joenpolvi. I am the CEO of a company called ADESANTE, which is a Finnish medtech company, 2 years old, and focusing on developing extended reality solutions for healthcare service providers. Our solutions are for helping in perioperative process, in overall, starting from preoperative planning, going through the intraoperative phase, where we are trying to reduce surgical failures and decrease over time in overall, but also for getting people discharged earlier from a hospital to home, saving governmental money from that perspective, but also for helping people to recover faster at home back to work. And these services are also needed for aging population to keep them in good fit and staying health longer. So that is what ADESANTE is doing.
Great, thank you, Petteri. And Ville, let's go next to you.
Thanks, Sami. So my name is Ville Mujonen. I'm the CEO of Ninchat. We're integrated messaging, chat type of messaging, video messaging, bot-style messaging solution that can be used for doctor-patient communications, business automations, and also sharing internal resources over multiple locations. So, for example, having a specialist doctor serve multiple hospitals. Thanks.
Great, thank you, Ville. And Johan.
Thanks, Sami. So I'm Johan Möller. I'm a director for Brighter in Southeast Asia. Brighter is a Swedish startup that is working to allow patients of diabetes to share their blood glucose values as well as injected insulin amount to their doctors and also other stakeholders that the patient wishes to share their data with. So Brighter has developed our own medical device that measures blood glucose as well as the injected amount of insulin at the patient, and then they can share that to their healthcare provider. This allows for better follow-up and lower complications, reducing the cost of the world's most expensive disease, diabetes. Thanks.
Great, thank you, Johan. And then last but not least, Dr. Kari Aho from Secapp.
Thank you, Sami. Yeah, I'm Kari Aho. I'm the CEO and co-founder of Secapp. And what we do at Secapp is a SaaS service for effortless critical communications and alerting that makes sure that we can capture the attention of needed individuals when needed. Secapp has, for instance, helped ministries of health, hospital, ambulance, and volunteer services in Europe and Middle East to respond to various emergencies in a matter of seconds, and also to keep their daily communications as secure as possible.
Great, thank you, Kari. Okay, let's then continue then by mapping the different opportunities in your ecosystem. This question will be for all, but maybe we stay with you, Kari. Kari, so what are the opportunities in your ecosystem?
So if I look at the ecosystem in terms of healthcare, but also from a communications landscape where we are at, so I would highlight 5 different points from that. One huge opportunity, of course, in the Nordic, but I see that happening throughout the world, is the change of device space. Whereas before we had separate devices like pagers, radio phones, tetra devices, and so forth, we are seeing a big shift towards using personal devices, introduction of smart devices, and so forth. So that opens up a lot of possibilities to introduce new solutions to hospitals and critical communications landscape. And if we move from that to the second point, the change of service needs. So we are long gone from pen and paper, or try to remind what we need to do and when. And of course, in terms of communication, we just can't rely anymore on short messages or voice-based communications, but we need to introduce even data-heavy solutions. But anyway, to utilize the communication and the platforms to exchange information, regardless where we are and when we are. The third point being that whereas before we had kind of different silos, or each of the hospitals had their own services, own server environments, and so forth, I see that that has changed in the past 2 or 3 years quite a bit. So first of all, of course, the evolution of SaaS services in general, but their acceptance for critical use is something that has opened a lot of opportunities in the ecosystem that we are in. Moreover, the fourth point would be cooperation. At least in the Nordics, the authorities have very good cooperation between themselves. So hospitals are not doing the work by themselves, but they actually work very tightly alongside with police, as well as fire and rescue. And that happens within these countries. But that's not all, because the Nordics, for instance, Norwegian, Swedish, and Finnish security networks and where the authorities communicate, they have been already integrated now. And that means that they can actually do also cross-border cooperation, and they do that quite a bit. And again, a lot of opportunities in that landscape as well. And the final one is not just technical one, but it's also, if we look at the landscape through change of political, environmental, or regulatory, or even behavioral landscape. Unfortunately, we are seeing more civil unrests, epidemics, extreme weather conditions, and so forth, which actually increase quite a bit the demand for safety, security, and communication solutions to maintain essential services, even during these emergencies and crises that we are seeing. So these would be my highlights on the topic.
Good. Great, thanks. And we will come back later on to that joint Nordic collaboration and platforms as well. But let's jump then to the Johan. So how do you see the opportunities in your ecosystem from your side, from Sweden?
In Sweden, the healthcare ecosystem is quite advanced. I think one thing that separates the Nordics from many regions is that we have the universal healthcare coverage. So basically for all patients, healthcare is heavily subsidized. This is both for medical devices as well as pharmaceuticals. This has an impact in the behavior of both the prescribing doctors as well as the patients. And I think that the long-term thinking and the implications of healthcare, you can have a longer perspective where you see the cost of healthcare from a lifetime perspective. So that I think that changes part of the healthcare from a patient perspective as well, since everyone has access to the same level. Another thing is on regulatory. Sweden is of course part of the EU, and as such we follow the CE for all medical devices as well as services. And we are upgrading regulations right now to the MDR, and that means that the regulatory burden for us is quite high initially, but when passing it, it means also that we have pretty good access to the rest of the world when exporting. Our devices are basically export ready as soon as they're approved for Europe. So I think that's a good opportunity. Another one is on advanced actors in the ecosystem. So we have both from the buying side, we have public tendering happening from the public healthcare system usually happens in long cycles, but when it's done quite professionally, and evaluation criteria such as behavioral aspects and total cost of solutions, etc., are taken into account in a way that over-the-counter healthcare economies might not work. I think technological readiness in suppliers is also one thing. We have access to good manufacturing as well as connectivity services that are quite advanced, and it's easy for us to find partners to co-innovate with. So those assets are fantastic for a startup to work within. It becomes like a cluster of companies that can support each other, and maybe not find completely new innovations all the time, but find innovative ways to combine technologies. And I see that both in the healthcare ecosystem, but also in other services. And there's been quite a few successful export activities from merging different business areas or different companies and technologies. So it's quite exciting to sit in the middle of this. And moving abroad, I think that one always have to adjust to the local conditions in any market we come to. But coming from Europe, I think is a solid background. So we know that all the solutions will be secure and safe for the patients just due to our heavy regulation.
Good. Thanks, Johan. Ville, anything you would like to add besides these previous good opportunities, what Johan and Kari highlighted?
Yeah, I think Finland, the Nordics in general is a pretty unique spot in the world. So from the total operational and patient point of view, so what we got, so we've got a strong authentication of the end patients. We've got e-prescriptions that are working as well with central databases. So kind of like the Nordics can work as kind of test bed. So kind of you want to kind of build a new kind of service that you can then kind of anyone could kind of strongly authenticate and get the service they need. And there's like huge gap when looking at many countries, kind of how you manage this, how the market is open for different kind of players, as well as another point. Still, I'd take that the kind of the general. The atmosphere is quite open and positive for startup type operations. So it's easy to get support and funded, and the health ecosystem players are open for new innovations. So it's quite it's feasible actually to try and then build and then kind of get the kind of the product right for the scaling. So I think that's kind of pretty unique for the whole Nordics.
Good. Thanks, Ville. Petteri, anything to add on? We had a good
Not too much to add, Sami, but maybe I would like to highlight these data lakes, what we have due to this long history of digitalization of healthcare, which are extremely great for research purposes. And based on that research done against the real data of the patients from decades, really brings value to the companies working in here. And all these solutions, what is developed accordingly and based on this data, could be also tested in the hospitals with very, very low cost because of this public funding of the healthcare services what we have.
Good. Thank you, Petteri. All right. Well, we all know that no ecosystem is perfect, right? And maybe, Petteri, we stay with you. And what is the key challenge in your ecosystem? What do you see? If you would need to highlight one, what would
As a startup company, I was just going to continue by saying that even though we get into hospital pretty easily for doing the clinical validations and verification for the solution, the commercialization of the solution is more challenging because of this public funding of the hospitals as well, and because of the regulations what we have. Every system and solution needs to follow purchasing rules of the EU and the public tendering rules, which is time consuming, and getting new technology into market might take some time. But anyway, we have good tools for that, good landscape to work on that, and we have very detailed description of how to follow those rules and how to get it done. So there is pros and cons for being so strict and what comes to the following the rules. But anyway, the landscape is very good, having some challenges like the commercialization of the solution for sure.
Good. Ville, what do you see that what is the biggest challenge?
Yeah, I kind of said it's kind of like we got like all of the Nordic countries are quite small, and looking so that's of course kind of often kind of the benefits come with the scale. So kind of to kind of get the validation. So that can be a bit challenging as well. Kind of a challenge is actually that we've got such an advanced ecosystem, so that kind of like you can't replicate it like automatically like that to other countries. So you kind of the ecosystem should exist. So kind of it takes longer time as well. So there's no real quick wins. So that's maybe another viewpoint on that.
Good. And then how about you, Johan? What do you see that is the biggest challenge in the Swedish ecosystem?
I think one overall challenge with maybe all of Nordics, but I see it in Sweden, is that we've had data lake technology, we've had digital solutions for quite a while, as previously mentioned. One effect of this is that we have legacy software and legacy solutions that we are competing with, and adopting new technology usually means integration, and also means things like replacing other systems where users have very specific demands on the same behavior as the previous system. So that's a challenge when introducing something new, that the inheritance of the legacy systems and interoperability becomes challenging. I think that's true for any technologically matured market.
Yeah, good. Kari, anything you would like to add from the challenges point of view?
Of course, pretty much along the same lines. So what you have mentioned about the being a backward compatible, that's very important. And what Petteri raised about public procurement not being maybe the fastest element, of course, that needs to be taken into account. But maybe if I continue on the notion of the procurement, making a good RFQ is always a challenge, because what was highlighted by Paul in the beginning as well is that the medical professional, there's a lack of medical professionals, so they don't have too much time to actually focus on building RFQs, and that might then that can be seen as a challenge, and it can actually prolong the process. And moreover, you might get completely a mismatch in terms of RFQ and what you are actually aiming to get. So you should pay a focus on highlighting the use cases, what are the desired end results, and even to kind of change that. It's not just procurement in a very traditional sense that you just announce that, get the quotations and select one, but rather than try to make it more interactive in a way that you have the use cases, but put the tenderers to actually demonstrate how they actually respond to that in practice. So that way you could in some way to actually improve the process and make sure that you are actually getting the solutions that you need.
Good. Thank you, Kari, and all for these really good insights. Let's shift the gears then towards the partnerships conversation. So, and also, I know that all of you see the corporate partnerships quite important part of your business model and moving forward, but how important these are in order to help you guys grow? Are they common in your ecosystem? So if you can kind of like provide a little bit more overview as well. And are they easy to put in place? Maybe Ville, if you want to go first.
Yeah, thanks. I'm kind of intrigued to kind of still continue as a bridge from the previous kind of the ecosystem challenge. Is kind of like what happens is we are actually in general talking about kind of the change of behavior. And it's not just the ecosystem, and then you're kind of what you kind of end up having is you're kind of copying kind of old way of working and methods kind of digital. You're having a kind of physical doctor appointment, and then someone like wants to make it a kind of digital doctor appointment, and they're kind of forgetting what's the purpose of it, and kind of like what are we trying to kind of reach. And kind of like this type of kind of the real opportunity lies when you're kind of like rethinking the wires of the internet kind of for the benefit of the patient or for the benefit of the health professional, how to kind of make it all work seamlessly. So from and in this part, so that's kind of the challenge, but in the same time, it's an opportunity. And here comes the corporate kind of partnerships. Our company, for example, we are building these integrated solution in a customer look and feel and integrate to the existing health platforms, and also are the driver in the kind of how does the health service provider change their way of working. So that's so I found it really easy to kind of build a cooperation with corporates, and I think that's to reach the volumes. It's really essential, but there's a catch. So our approach was to first build API that can do pretty much anything regarding messaging, and just on top of that, build the first client-based MVP. So very often startups like you build an MVP and then you find out, okay, it's not at all what you wanted, and it's kind of difficult to kind of change. And then you have when you have 5 clients and each of them is different, then you're kind of stuck. So it's kind of, it can be heaven or hell depending on kind of your approach.
Yeah, good. Kari, how about your side, corporate partnerships?
Yeah. Will mentioned very good points in his part. Maybe to continue from that, yeah, I completely agree that building APIs, being integratable to other systems, that's a crucial part in building the partnerships, in building the business, in getting you accepted in the ecosystem. That's crucial, of course. Making successful MVPs, so minimal viable products, of course, that takes. You shouldn't do that yourself. So don't do that in your basement and think that it's going to be ready. But engage the customers, engage the partners as early on as possible to actually achieve a good result from that. But moving further from those notions, to look at the partner landscape and how important that is. So if you take any small or medium-sized organization, they just don't have the resources to actually expand globally without actually building a partner network. And if you would start building your own organizations throughout the world, that would consume a lot of money, a lot of time, a lot of resources, and you will still probably not have very good chance of succeed. So building partners is critical in terms of building your international business. And a few examples from our side, what kind of partners do we have? So we actually have, even though we are in a startup or in small or medium-sized company, we already have established cooperation and partnership with billion-dollar organizations like Airbus Defense and Space, globally, Saudi Telecom Company, which is Middle East telecom operator, very established, very well known there. And how can you actually build partnerships with these kind of huge organizations? It's not that hard. It's just a matter of building the trust, working with the people, so and making sure that what you promise you actually deliver. So and of course the first point of contact with them should not be that you agree a proof of concept or customer case, and the first thing is that you're going to present them that here's an invoice we won't do anything without this, but you should also consider taking some degree of risk. So that way it allows you actually opportunity to start building the trust, gaining the trust. And once you have these partners, you can actually use them to also leverage to get new ones, because they are usually very well connected, and if they have positive experiences working with you, they will be happy to tell that to the others as well. And looking at the partnership landscape, what I mentioned, we have these huge partners, and that of course takes time to build those. But that is also complemented with smaller organizations or mid-sized organizations that we have from security and risk management companies that combine our service. So it's not just a digital service to the end customer, but what they do is that they combine security cards, 24/7 control rooms, separate devices and so forth, what they actually provide for the end customer, making that much more comprehensive solution, and not just a technical platform or just a separate device or a separate service, but instead of combining all of these. And this also works with the bigger organizations or partners that we work with. So with Airbus, they are of course selling the not the airplanes in this case, but they are selling this authority or professional domain or public safety end user devices, meaning phones, networks, and so forth. So they combine that with Secapp as a digital platform, and they provide the physical devices. With the telecom operators, they provide subscriptions, data subscriptions, devices, other services, support, and so forth. So it's always a combination. Try to look at from perspective how you can create a win-win situation, how they will complement each other, how you can boost the sales of other products or services that the partners have, and what kind of additional value they bring to you. So can they bring new customers, support services? Can they bring content to your platform, which would be highly valuable for your customers, and so forth?
Okay.
A long answer, but hopefully something out of it.
Yeah, so having that really that holistic point of view and think about that long-term solution instead of just focusing on those short terms. Good. Johan, device is quite a crucial part of your solution. So in that world, partnerships with corporates, how important these are to help you grow?
Of course, absolutely crucial, Sami. We manufacture a device that also has a modem and a connection in it. So for that to just work from a hardware perspective, we need a lot of co-innovation partnerships with the parts manufacturers for some of our parts to validate that everything works together. But that's pretty normal. I think one thing that comes on top of that is as you start working together quite intense to co-innovate and build a solution together, you also see that you have spillover in different capabilities of your different entities when it comes to business development. And that's something that we see, for example, in our partnership with Ericsson, a large manufacturer of mobile network equipment. And they're, of course, present in many markets in the world with capabilities that greatly supplements Brighter's medical device services and solutions. So when it comes to things like offering subscription models, when it comes to things like connectivity opportunities, having a partner that is really strong in that field has been a great benefit to Brighter. On top of that, being a medical device company, since we manufacture our own medical device, it's also crucial for us that our suppliers, as well as our consumables parts manufacturers that we collaborate with, that we have a very tight dialogue with them to set the common product roadmap and understanding how they see development. So partnerships from the hardware perspective is crucial. From the business development side, I think it's extremely interesting, and it's something that we've had great benefit from. And I think just like Kari said, to some extent, when you find common grounds and when you find a mutually interesting project that would give benefits to both entities, then you can do really interesting things. Because for us, going into a new market is, of course, a huge commitment for a patient's safety perspective, and also in terms of our investment and cost to deploy locally and register. So having local entities, both local and companies that we are collaborating with from our Swedish headquarters, have been fantastic in supporting us in our go-to-market strategies, both in terms of regulatory side as well as hardware, but also on the business development side. So I think standing on the shoulder of giants is maybe a good way to say it, and that's a very effective thing for startups, to use the companies that already have done parts of the journey and find ways to make it profitable for both your company and for them. Just like Kari said, I think that's a winning combination, and it will ease your access and give you access to that much knowledge and experience from these markets that otherwise are very difficult to find.
Good. And Petteri, I would like to expand this question a little bit with your question, because I know that you have been exploring Southeast Asian markets quite actively, and I know that the corporate partnerships are crucial in the Nordics. Do you see differences between collaborating with the Southeast Asian or Singapore-based corporates versus Nordics?
Well, not too much in overall, because we are working in healthcare IT business, and when speaking about Southeast Asia, the IT infrastructure is very advanced, similar level like what we have here in Nordic countries. We need to do cooperation as an IT company with Microsoft, Amazon, IBM, just name the companies, and Tencent maybe in China. And when looking at broader perspective, even the telecom companies for 5G technologies, for rapid exchange of information, low latency data exchange, we need to look at also our technologies outside of our own industry, healthcare industry, when speaking about getting care facilities into data, turning facilities into data with the LiDAR camera technology, or like utilizing blockchain for secure data exchange, like what the fintech companies are already doing, or looking at AI in broader perspective, getting computer vision in through that AI solutions, computer vision which is already used in automotive industry. And so a lot of technology partners would be needed when developing new IT solutions, and it does not vary too much where you are doing this or utilizing these solutions, whether it's Southeast Asia or Europe. But healthcare is in change, and how to utilize the data is in change, and for that we need both big corporates to cooperate with.
Thank you, Petteri. Let's stay with you, Petteri, but let's jump to the regulatory environment. And I want to hear from Petteri from Finland, and perhaps Johan, then you could cover the Swedish side. So is the regulatory environment friendly to digital health startups, and what should other startups or even corporates know before entering the Nordic countries?
Is this consistent because we have very clear regulatory environment what comes to the medical devices, MDD, MDR, and that applies to healthcare IT solutions as well, what I'm representing here. And in that phase, it does not make any change whether you are developing healthcare IT solutions for European market, whether it's Southern European or Northern European, all fits to the same format and has to follow the same regulation. So from my perspective, it's very company friendly, because you know exactly what is required to get into the market, what is required for doing something, and it puts you the clear rules, what you follow, and if you're following that, you have the whole market in your hands.
Good. So very well documented, very well communicated, and very clear also for the digital healthcare solutions.
Yes.
Johan?
Yeah, I would definitely echo what Petteri said on the transparency and predictability of the process of entering Europe as a large market is fantastic for companies. So that's very regulatory friendly. Maybe just to add on that, entering into Sweden, and I would suspect that it's the same for our Nordic neighbors as well. It's you can find good collaboration partners both from academia as well as from private companies. So when it comes to test beds, to try out your technology and get some experience on the ground, that would also help you later on when you communicate about your solution. So the regulatory environment for that is also friendly in the sense that it's accessible, it's proven, it's been tried and tested, it's happening all the time and evolving, and it's very predictable. So I would say that from a regulatory perspective, probably all of Europe is very friendly for health tech startups. And just like Petteri said, when you win one market in Europe, then you have access to all of them. With that in mind, you would also have to do localizations for each European market, because there are differences, even though from a regulatory perspective, we all follow the same regulations.
I mean, may I still add one thing?
Please.
On top of that? If a company product fulfills our MDR or current MDD regulations, it helps company to bring product, for example, to Southeast Asia market, and bring product to the Middle East market, or even getting FDA clearance. It helps a lot, because this MDR regulation is highly appreciated by our similar auditing organizations as well.
Good. Thanks, Petteri, for that add-on. Okay.
Maybe one addition to those is based on our experience, something that you should be prepared for. This relates to what you have mentioned about being prepared to localize. One aspect might be that even though the regulatory landscape allows us to actually store the data within EU, but in most of the countries, what we've at least seen is that the end customers require that your data centers should be within that given country where you operate. So that is something that you should be prepared for. And that has been crucial, for instance, for us in Finland and in other countries as well. So the requirement is that the data should be within the country related to those customers.
Good. Very, very good and important add-on. So actually, Kari, let's stay with you and let's talk about money next, because I know that you guys are fundraising. So let's talk about a little bit that landscape in the Nordics. So how do you see that? How friendly is the Nordic investment ecosystem then towards the digital health startups?
To my experience, they are very interested. Of course, healthcare, as stated already today, multiple times, is an industry that is growing hugely. We are seeing the aging population. We have a lot of demand on resources and how to actually improve the performance of our healthcare and so forth. So, of course, investors are looking into companies that can actually work in that domain, and they have proven track record that there's room to actually grow with these companies and make sense to invest into them. So in general, the landscape is very positive, and for instance, we're getting contacts, maybe not every week, but every second week, that someone would be interested in investing to us.
Is it positive across? Is it positive? Sorry to interrupt. Is it positive across all the stages, or how that evolves?
Of course, seed funding. There are different organizations that help you with that, but of course, you need to make sure that you are willing to invest yourself as well. So it's not just getting the external money, but when doing the seed funding, make sure that you are willing to invest yourself as well. So that shows your commitment as well. And for the next investment rounds like seed A, seed B, and so forth, of course maybe it gets hard. Of course, it gets harder when you go through these different funding rounds. I'd say that round A, there you can still work with the Nordic investors quite good, but then when moving from that to the following rounds, then most likely you will need to involve more international investors as part of that landscape.
Yeah, good. I want to expand this question a little bit and talk with you, Ville. Have you seen, are there a lot of cross-border investments between the different countries in the Nordics? Are Swedish investors looking to Finland, Norway, Finnish to Sweden?
Yeah, I do think that there's a lot of interest and activity across the borders, and even across the industries. So not only specific, like EQT Ventures is like one example, or in the game it is like Supercell. That's kind of like looking for different kind of like new interesting companies all around. So or just like another highlight, like we're growing by from our cash flow by leveraging our corporate partnerships and building distribution channels. So and already now there's over 5,000 health professionals using and over 1 million patients consulted through the platform. So you can get a lot of traction also without investments in that sense in this area. But in the same time kind of like I'd say that it's you should be quite specific regarding industry wise. So if you're aiming for a certain disease or certain condition or certain type of pharma, so what is kind of like how to scale? So you need to have a pretty clear. So then I kind of say that from the medical industry kind of opens the investment round in being extremely specified a solution, or then you need to have a loads of money and go like crew. That's what
okay. I'm a little bit conscious about time, so let's move forward and then talk about different support programs, what the ecosystems are providing, and maybe we again cover Sweden and Finland here separately. So basically, what are the different support programs offered by your ecosystem to help companies like you then to grow and go abroad? And maybe Johan, if you wanna answer from the Swedish side.
Sure, thanks, Sami. So the support programs from the Swedish healthcare ecosystem is quite strong in Sweden, where we have both from the public sector, such as hospitals and governmental agencies like Vinnova that would help companies with innovative solutions to scale up and support with network and contacts. There's also other governmental agencies specifically working to support. So I think from a governmental side, it's very good access to both knowledge and support with regulatory, etc. Then there are these semi-governmental bodies like Business Sweden or the Swedish Trade and Invest Council, offering quite a lot of delegations to markets that companies are interested to go into, as well as information on regulatory things, specifics in that market or things that are good to know. So the support organizations are very well established in Sweden, both for domestic operations as well as for export. I think one more thing on that is support programs offered by private companies or through networks, and we see those in healthcare in terms of different collaborative groups, and we also have access to some in the mobile network operations sphere due to our collaboration, and that also extends internationally because there are usually mirrored organizations in different regions. So a collaboration with an ecosystem in the Nordics would then give you access to collaboration with a similar ecosystem regionally. So I think leveraging both your own support programs or support ecosystems, as well as those of your partners, is a good way to do business, and those do exist to a quite mature standard in Sweden.
Good. How about Kari from the Finnish side?
Yes, it seems to be pretty much well aligned with what you have mentioned about Sweden. But maybe to summarize, so in terms of funding, there are various different elements for grants and loans in different stages of the company. So when you're forming it, you can get an entrepreneurial kind of grant to start building it. When you move forward, you can have R&D funding and grants and even loans for that. There are elements to support key recruitments, market studies, organizational development, scaling up to international markets, and so forth. So different elements for funding, even from the public sources, and of course you can complement those with external investors as well. But on top of that, you get help also regionally. So you have these business hubs in the major cities, at least. So you see them of course, in Helsinki, in Espoo, even in central Finland, where I'm from. So in Jyväskylä, we have a business development organization that helps the companies that are there to actually establish business internationally as well. And how they do that, they leverage different events, huge international events like Business Rally, which is one of the biggest events in Finland that has been utilized from a business perspective, that they invite key stakeholders across the world to be there for the week, and then they combine those with the different organizations that are within that domain. And of course, the city officials, they help to bring the kind of credibility when you're working with different organizations. So they kind of guarantee that this organization or this company is really there. They are to be trusted and so forth. They provide, of course, advisory services and so forth. And if we move from the regional landscape to international markets and as a nation, there are different elements to support that. One very interesting is this joint market entry trips. At least before COVID, we had those quite a bit. So where actually the key ministers from the government of Finland, they take part on these trips to help to actually establish business in a given market. So they take a bunch of companies from Finland, the minister or the representative from there is meeting with them, different stakeholders, and helping to establish credibility and business in new markets. Then, of course, we have a huge network throughout the world. So ambassadors, ambassadors, Business Finland, which actually provide their services free of charge. So you can utilize them to get initial market intelligence, contacts to different local organizations, or help them to bring kind of form events and so forth, which help a lot. And then, of course, there are these Nordic-wide programs like Nordic Innovation House is an excellent example of that, where the Nordic resources have been pulled into a common program helping to establish operations in Singapore, Tokyo, Hong Kong, New York, and so forth. So a lot of elements available there. It's just a matter of taking them into use.
Yeah, good. Petteri, I know that you've been also active in this front. Anything you wanna add?
Well, not too much. It was pretty widely covered already by the previous speakers, and these local health hubs or the hubs in our business hubs, there is plenty of them, but personally I have a feeling that some of them are even competing each other for getting companies in there, and as a small country I wish them to make more detailed cooperation between each others, and same applies to the country level organizations. Luckily we have places like Nordic Innovation House, which is bringing Nordic country companies into the world as a turnkey solution as such, and we need to be bigger in our world. We are playing very small here in our regions and countries and cities, and for doing that we need some development here in the region in overall, speaking about the Nordic region. But we have plenty of vehicles and plenty of tools to take first steps as a companies, but when really needs to be big, really needs to go international, when we have still some challenges here in the region. And I know Swedish companies are very good on that, and Finn still has a lot to learn what to do and how to do. We have some success stories, but of course we have plenty of failures as well. And the same applies to the funding rounds. Seed funding is extremely easy to get in the region, but when starting to look at the A round, not even speaking about the B round, it's getting more challenging and more international contacts would be needed.
Okay. I think we could probably continue this conversation for at least a couple of additional hours, but we are running out of time, and I want to conclude this to basically hear what is the next market where you guys are expanding to. So very quickly, Petteri, maybe you want to start.
Expanding in Southeast Asia in overall, and then taking first steps in US.
Good. Ville?
In Southeast Asia, we are now looking for distribution partners, and as well we are rolling out in Europe.
Good. Kari?
Have to agree on that. So we are, of course, why we are part of this event as well is that we're looking into Singapore and Southeast Asia to support, for instance, Japan, where we already have operations. So broadening up our presence in Asian market as well.
Good. And how about you, Johan?
For us, any market where diabetes is a big problem and has been identified as such is long-term interesting for us. We're currently expanding in Southeast Asia, namely in Thailand, Malaysia, Singapore, and Indonesia, and doing medical device registrations. On top of that, we're also working in the Gulf states, so that includes countries like United Arab Emirates and the surrounding countries, on top of our home market, which is, of course, Sweden and Europe.
Good. Sounds like all of you guys are going to have a very busy future ahead. Great. So that was our last question. So we have come to an end of our Nordic ecosystem discovery session. At this point, I want to thank Paul for your great keynote, and of course, Kari, Ville, Johan, and Petteri for sharing all these experiences and being here today with us. And for the audience, remember to visit their digital booth and continue the conversation and hear more about their next steps in here in Southeast Asia. So thanks again for everybody. Stay healthy and goodbye.